Hey, this is Dave O'Sullivan here, and in today's lesson we're going to cover what to do when your patient's not adhering to your exercises. Okay, and this is the biggest frustration that certainly was there for me as a new grad, especially when I first started out in private practice. But what I quickly realized was that actually the problem with the patient exercise adherence, it's not actually a problem with the patient, it's a problem with something that we've done. Okay, so the problem with patient exercise adherence actually starts in the subjective assessment. Okay, and that is that we're so focused on the pain, we're asking the patient all about the pain, that we almost forget to see the actual person in front of us. So every exercise we prescribe, every explanation we prescribe, it's all about pain. Okay, it's not about the person. And ultimately, us as human beings, we're selfish. Okay, we're naturally going to be asking that question subconsciously, what's in it for me? So the next time you're prescribing an exercise and you're telling your patient, oh, this exercise is going to help your back, etc., consciously we're like, yeah, good. Subconsciously, we're like, what's in it for me? Okay, what's in it for me as a person? Okay, so that's where the subjective assessment, we have to identify something that's called the internal motivator for the patient. Okay, now this internal motivator, this is present in professional athletes, it's present in NHS patients, it's present in private practice patients here. Okay, the internal motivator is the thing that's going to cause that person to take action. Okay, so a person comes into me with back pain. Okay, they haven't come in to me with back pain, they've come into me because that back pain is stopping them doing something. Okay, so what has motivated that patient to come into me in the first place and actually take action? Okay, so if my rehab exercise is all about the back and I don't understand the ideal outcome for the patient and where that patient wants to go, then the chances of me being successful are very, very slim from my experience. Compared to now, when we focus on what that person's ideal outcome is, then two magical things happen. Number one, I've got massive clarity on what I need to do to prescribe a rehab program, because if that person doesn't know their outcome, how am I supposed to prescribe a rehab program? Okay, and that's the exact same for professional athletes. Then number two, the patient has clarity. The patient understands the process that needs to happen in order for them to get back to that ideal outcome. Okay, now whether we like it or not, when a person comes into us, we are selling a transformation. Okay, we're selling where they are now in pain to where they want to get to. Okay, and unless that person can see how that exercise fits along that journey to get them back to that ideal outcome, then very, very often the adherence isn't there. Whereas if you can relate this specific exercise you're doing to how it's going to help that person, but most importantly, it makes sense. Okay, if you can explain, okay, and your explanation makes sense, they can understand it, process that information, and then they can see the value in how that's going to help them. Okay, the person, not their back, them. Okay, and that's a very, very important thing just to keep into consideration, because sometimes, and I'm guilty of it as well, we get so focused on that area of the body, we forget about the person. Okay, so the next time the patient isn't adherent to your exercises, I want you to reflect on what you've done in that first session. Okay, how much time did you spend explaining, okay, what needs to be done in order to get them back to that ideal outcome? Okay, so do they actually have clarity on where they want to get to? Okay, the amount of times I have especially persistent pain, back pain patient that comes into me and I say, okay, where do you want to get to? Okay, where are we going? What are we working on getting to? I just don't want to be in pain. Okay, that's all they say to me. So my response is, well, unless you know where you want to get back to and what you want to get back doing, then how can I prescribe a rehab plan for you? Okay, it's the same with professional sport. An athlete comes to me, I say, what do you want to get back doing? Okay, and I do not accept get back playing. Okay, we need to be as specific as we can. We need to focus their attention, okay, on peak performance for that person. Okay, so that athlete has a set of characteristics, it's got a set of traits that they do well. When they're performing those traits, okay, they're in peak performance. Okay, and only them, they know what that is. Okay, and only they can prescribe that or describe that to us. Okay, it's the same with a person asking the question, what happens when you are moving well? What does it feel like? Okay, all these kind of questions, they direct their attention back to where they want to get to. And I know it sounds a little bit out there, But you will not believe the transformation once you start looking at the person, looking at the outcome, okay, and you focus your attention back towards peak performance. So every single patient that comes into me, I'm not trying to get rid of their back pain. I'm trying to get them moving towards peak performance, okay? And if we get them somewhere close to that peak performance, we're still going to be in very, very good shape, okay? So that's why in the mentorship, I focus my first full week on that subjective assessment, because that subjective assessment, that's going to actually, number one, it's going to identify the internal motivator, and number two, it's going to actually identify the ideal outcome, okay? And then the third thing as well that we do is we actually start to extract meaningful information from the patient so that we understand the language that they use, how they want to feel, what they want to be able to do, okay? And once we have all that information, then prescribing that step-by-step graded exposure rate program becomes very, very easy. Okay, so the next time your patient's not adherent to your exercises, just take a step back and just reflect on what went down on that subjective assessment, that explanation of the findings, explanation of the plan in the first session. Okay, week one of my mentorship, we go in depth in that because that's the most important thing. A lack of clarity, what's in it for me, okay, are two of the biggest things that I see clinically why patients don't adhere to our exercises. Okay, I'll see you next time. My name is Dave O'Sullivan. As always, thanks for listening.